we went back and looked at, the cornucopia of videos that we've had, and one thing that we saw that we were really glaringly missing was a video about Asian rhinoplasty, what our philosophy around that is, what our process is, and so I'm going to start with you.
I think we get the word cornucopia into one of our videos. So we get a lot of Asian American patients who come to see us. And obviously there's a really vast array of experience and anatomy and aesthetics within people of different Asian backgrounds. So it's very hard to kind of pigeonhole it into one video, but we'll kind of give a sense of our experience in general.
Yeah, it's really, when we talk about sort of ethnic rhinoplasty in general, we always sort of hedge and go back to this idea that within any group, you're going to have the entire range of aesthetic, noses, anatomy. So we're really sort of broadly stroking this. Most Asian rhinoplasties who come and see us, we'd say the primary concern is perhaps lack of tip definition, wanting some refinement in the tip, 2, perhaps nostril width, oftentimes feeling like the nose feels a little too wide, and then 3, there's always the discussion of, do we want the bridge higher or not?
Yeah, those are really the common themes. In our experience, we would say that the bridge height, or the idea of bridge augmentation, really is a distant third in terms of the ideas or concepts that we talk about, because for the most part, most of our experience with people is from the front view, and I think a lot of people are uncomfortable with the idea of their nose feeling a little bit too wide for them, or a little undefined, the tip feeling a little bulbous or full, and the nostrils feeling too wide or flared. And that's where we focus a lot of our attention.
Yeah, if you want the details about nostrils, alar base reduction, that sort of thing, obviously we have a whole separate video with respect to that. So that's one of the primary concerns. You can reflect on that. 2, with respect to skin thickness, it is important. One of the things we tell a lot of Asian patients is Asian patients in some ways are a lot like Middle Eastern patients in the sense of skin thickness. You really don't have the same ability to contract. There isn't that same fibrofatty layer that we sometimes talk about with African Americans. So skin thickness is a really important concept with respect to having to build against the skin to get that sense of refinement, as opposed to really reductive procedures. I think those are the 2 things when we talk about tip width and nostrils. Bridge height, it's really a personal conversation. Some patients come in and say, I really don't want my bridge this low. I don't like it. That's my primary concern. I want sort of a more quote-unquote westernized effect. And if that's the case, we talk about what all the options are there, whether it's your own septal cartilage, ear cartilage, rib cartilage. We don't do sort of foreign materials, Gore-Tex and things like that. We go over why we don't like silicone implants.
Yeah, really the key concept in creating that refinement that we want to for Asian rhinoplasty patients is creating structure. And a lot of that centers around the tip. You can build the bridge or not build the bridge, and that doesn't really affect our ability to create real tip definition, real tip structure. To do that, very often we find that the existing tip cartilages are a little bit too soft in many patients. They often don't provide enough support or structure or framework to allow the skin to drape around it in a way that's going to create refinement. So we very often have to provide some added tip support. And like Dr. Solieman said, we do that using the patient's own cartilage for the most part if we can from their septum, but very often we talk to them also about the need for using some cartilage from somewhere else.
We have a lot of Asian patients, so if you are interested, please come in. If you're wondering where the pictures are, most Asian rhinoplasty patients don't let us use their pictures, so maybe you will.